But we begin with our interview with Minnesota's Governor Tim Pawlenty. I went to St. Paul, the state capital, to talk to him this week, and we began with the day's dominant political issue, health care reform. You are a critic of the Obama health care initiatives. Should Minnesota, which offers a sets of choices, and the Mayo Clinic, where doctors are paid a fixed salary, should that be the model for the nation?
Well, in some ways, Minnesota is a model for the nation, but in other ways, we have to be cautious. The Obama plan, in my view, does a number of things wrong, Al, including this public option where the government's going to directly compete with the private market is misguided. I don't like the idea that it'll feature increased costs, not reduced costs, including tax burdens being increased on small employers, mandates to the state that will increase our costs, and much else. But as we look to not just being critics, but what we can do now to offer a better direction, we should look to things in Minnesota like paying for performance. We have a system now where after you and I pay our co-pays or deductibles, we don't have a big stake in how much things cost. Providers get paid for volumes of procedures, and if you pay for volumes of procedures, you're going to get more procedures. And so we need to pay for better health care outcomes, and aligning payments with the outcomes that we would like. Minnesota has got some great examples of that, including some elements of the Mayo Clinic. But we also have our own challenges here in Minnesota as well.
Is the Minnesota plan better than the Massachusetts health care plan?
The Minnesota Advantage plan clearly is part of where we need to head in terms of paying for performance and efficiency.
But better than Massachusetts?
Well, the Massachusetts plan succeeded in expanding access, but it has not succeeded in controlling costs. Massachusetts now has, according to one recent study, the highest health care premiums in the nation, amongst the highest health care costs in the nation. And the early projections for that program, not the final ones, but the early ones, have now been doubled or tripled, and the program is going to have to either be reduced or they're going to have to rely on federal bailouts.
Well, you studied this issue. Did Governor Romney make a mistake then in pushing that plan through?
Well, in fairness to Governor Romney, he hasn't been governor of that state for almost 4 years.
No, but it was launched under him.
Yes, but I think if he were there, knowing Governor Romney as I do, I think he would have made some mid-course corrections or tried to do some things to get it back under control.
But was some of it ill-conceived?
Well, a success as to expanding access, clearly not a success as to containing costs. Now, in fairness to Governor Romney, he would say the last estimates coming out of the conference committee have basically been met, but those estimates have a spiraling cost going forward.
One more question about the national debate. There's a lot of what some people think are careless terms tossed around, like death panels and socialized medicine, principally by conservative critics. Has that been a mistake and detracted from the merits of the debate?
Well, I think the Republicans should be aggressive in criticizing President Obama's plan and the plans of the Congress. They are bad ideas, and the phrase...
But they're not death panels, are they?
Well, they may lead to a different form of healthcare decision-making and ultimately rationing. I think that's a fair critique of the Obama plan. Whether you call it rationing, whether you call it death panels or some other label, I think it's fair to say this plan, if adopted, will result in different kinds of healthcare decision-making, probably rationing if you're really going to be serious about it, and that could lead to people getting different treatments.
Don't we ration by income, by price right now? I can afford payments that a welder can't afford.
Well, most Americans, particularly in places like Minnesota, get some type of health care. Even if you're uninsured, you tend to go to an emergency room. Right. It's not the smartest way to do it, obviously, from a systematic standpoint.
And outcomes aren't as good.
That's right. But very few Americans are denied outright health care.
Let's turn to the economy. Still in rough shape, but a lot of experts say it's beginning to rebound, that we hit bottom and coming back now, and that the Obama stimulus plan is a contributing factor. You agree?
Well, I don't think that's statistically or factually accurate. At the time of this so-called bottoming out or now potential beginning of recovery, most of the stimulus funds haven't been spent, Al. So I don't know how you could, not you, but others could say...
Well, they say 15–20%'s been spent, and that's been a contributing factor.
Well, 15 to 20% of an $800 billion bill as compared to the total size of the economy would be ludicrous to claim that that's what pivoted the economy.
Do you still think the stimulus was a bad idea? I
think the package, if you look at not my rhetoric or Republican rhetoric, but even the General Accounting Office said of the $800 billion, only about $160 billion of it was stimulative, and the rest of it was largely not wasted, but government maintenance money and not stimulative. And so it was misdirected. I think we could have had a bigger bang for the buck targeting on things like reducing the payroll tax and putting money right into the pockets of individuals, or truly focusing on bread and butter infrastructure projects. That's not what this package did.
Governor, as you know, a lot of speculation. Will Pawlenty run in 2012? My dear friend and late colleague Tim Russert used to say, politicians are a lot better off if they're candid rather than coy. Why not just say, rather than go through this, geez, I want to serve out my term, why not just say, yeah, I'm real interested in it, and I may do it?
Because I don't know. I'm not being cute or coy with you. My thought is I'm going to finish out my term as governor, both here and in Minnesota and around the country. I'm going to try to speak to how the Republican Party can and should improve. And if that gets some traction and some momentum, then I would, consider that and not rule it in or out, but at least consider it. But I can't make that decision yet and won't make that decision yet, Al. So I'm not being coy. I just don't know.
You don't know. Let me ask you this. If you should make that decision, if you should make a decision that you are making a contribution, you have something to offer, what would a Pawlenty bring as opposed to a Romney or a Huckabee or a Palin, who've also been governors and are much better known?
Yeah, well, I always jokingly say to people, when you're potentially running for president, in recent times it tends to favor people who are either wealthy, have a shtick, or have some, fame. Since I have none of that, I don't know how I fit into that construct. But I think what I bring to the table is this. I think there is a value in governing a state like Minnesota as a conservative in terms of what that means to the rest of the country. I think I've been very effective as a reformer, keeping a lid on spending, trying to drive down tax burdens in relative terms in Minnesota. Been a reformer in education and health care. So I think the country is looking for leadership that is a hands-on leadership that can get things done and improve the lives of people without having the federal government do all of that. I've done that in Minnesota.
Final question, Governor. The Democrats for years had problems because of their intolerant base, their intolerant left. Do Republicans today, when you see a majority of senators, maybe two-thirds vote against Kathleen Sebelius for HHS Secretary, Sonia Sotomayor for the Supreme Court, is this a party now that's got a problem with a too rigid right-wing base?
Well, I think for folks who understand how political parties work, whether it's Democrat, Republican, or some other party, it's unrealistic to think, and we shouldn't expect parties to throw their values and principles overboard. Yeah. But we also have to realize that you got to present those principles and values in a way that connect with everyday people who may not be political activists. I think I've demonstrated I can do that in Minnesota. But our party overall is going to be a conservative party, and it should be.
Governor, thank you so much. We're talking to Governor Tim Pawlenty from the state capitol in St. Paul.